Okay, Cora Sack, Corasack, and I'm a pulmonologist and specialist in environmental and occupational health at the University of Washington.
Can you start by telling us the prolonged effects that happen from having weeks of air quality like this?
Well, there's a little bit of a difference between air pollution from wildfire smoke and traffic-related air pollution. Most of our studies have really been in traffic-related air pollution, and the studies in wildfire smoke have really shown mostly acute effects. So we don't really know what the chronic exposures do. I mean, we can look at the effects from traffic-related air pollution and make some inferences, but really we have most data on the acute effects.
What is in this stuff? So we're breathing it every day.
Yeah.
Obviously, there's various scales. It can be worse. It can be better. You can obviously see it. What's in it?
Yeah, well, it's a mix of different particles from liquids, solids, and gases from the combustion of mostly trees and bushes. Of course, if houses and other things get in the path of wildfire smoke, that's going to also have other things. But it has a mix of different chemicals that we know are bad for us, like polycyclic aromatic hydrocarbons or volatile organic carbons.
Give me an example of a VOC.
Yeah. Like carbon monoxide. And what we're really worried about is the particulate matter, and that's what gets into our lungs and what has been really mostly associated with health effects.
So, I mean, how dangerous are we talking? Like having this stuff here for days and weeks on end?
As I said, it's really mostly the acute effects of exposure, so we worry about exacerbations of underlying lung conditions like asthma exacerbations or chronic obstructive pulmonary disease exacerbations, and then people who have underlying cardiovascular problems that may be at increased risk of stroke or heart attacks. So those are the major things we're talking about, and more chronic effects, as I said, we don't have the greatest data on yet, but there is some suggestion that it may, over our whole population, potentially increase mortality.
Cora, can you give us an idea of when it's just an annoyance, man, I'm coughing, and when it's time to go to the doctor to get it checked out?
Yeah, I mean, that's a really important point, is that you should listen to your body. If you're feeling health effects, then go inside and relax. The more common symptoms are going to be a little bit of eye irritation or feeling cough. But really, if you're starting to have trouble breathing, if you're having chest pain, use your common sense. When you would go to the doctor normally is when you should still go to the doctor if you're having those same symptoms.
Are we at a point right now where people, shouldn't be outside? If you're talking to someone, in the most basic terms possible, what would you suggest for them, especially today and tomorrow as we see kind of the worst of it?
Right. Well, that depends on where you're living. Right here in Seattle, what we look at is the air quality index, and it's over 100 right now, which is really harmful mostly for those sensitive groups. So people who are in normal, healthy people can probably just go about their normal business. Once again, listen to your body. If you start feeling effects, go inside. And if you probably want to reduce the level of exercise you're doing outside. If you live somewhere where the air quality is worse, like Puyallup or down by Kent, then the air quality index is a little worse, and maybe you should limit your outdoor exposures. So it depends on where you are and what the air quality is like.
So if we're, obviously people will see this on the other side of the state where it's worse, where it really is unhealthy.
Yeah.
You've got all these small particulates. How far down into the lungs will that get? And does your body expel it, or do we end up with something like a smoker's lung, that we all have seen before?
Yeah, good question. So as you talked about before, kind of in the wildfire smoke, there's all different types of particles of different sizes. So a lot of them kind of stay in the upper and land in the upper respiratory tract, and some of them get lower down. Our lungs are really good at expelling particles. If you are a smoker, you may have delayed clearance. You may not be as good at getting those particles out, but probably this is an acute effect, and when the air quality goes back to normal, that risk is over, and your health risk should be about the same. So this isn't, these acute effects where the air quality gets worse from wildfire smoke for a few days. They probably do not have long-lasting effects in most of us.
What about people like firefighters who are out there all the time? dealing
Yeah.
with this season after season.
Right, yeah, that's a particularly vulnerable group, and they do try to wear respiratory protection, different respirators to help with reducing that particulate exposure. And the studies in firefighters in particular have been pretty mixed, and because they're such they're very healthy going in, that there hasn't actually been seen that much of an effect in change of lung function or those acute effects. So we're still having research. But
UV index, has it changed? Is it UV being filtered?
Yes, probably.
They wanted me to ask you that question.
Okay.
Yeah.
Can you going off of what Glenn asked you, can you kind of like bring that home for a little bit more urban construction workers? Can you talk about how they might see effects on their lungs working out in this environment all day?
I think people who are doing a heavy amount of activity because you're breathing in more of those pollutants may have, you're at higher risk of exposure. So the exposure to the wildfire smoke depends on kind of your dose, so how long you're out there, what you're doing. So if you're breathing at a higher rate, if you're doing exercise, you're bringing more pollution into your lungs. And so people who are at construction sites, they also have other pollutants that are exposed to from dust from what they're working with, from diesel exhaust, so they will be at higher risk, yes.
How does this compare to smoking, like smoking cigarettes? Like a period of time equal one cigarette?
So it does depend. Smoking is bad. It's made out of different particulates, and it's bad for your health in other ways. It's carcinogenic. But smoking is worse for your lungs than the wildfire smoke, yes.
Aside from just staying inside and avoiding, especially for our more sensitive populations, do you have any other suggestions for these people? I mean, are they supposed to be wearing masks? What other things can we tell our viewers so that they can get through this smoke?
So as I said, if you're a healthy individual, you can probably go about your normal activities. If you are concerned or feeling health effects, then staying inside, shutting the windows, using, if you have one available, an air purifier, a high efficiency air purifier, a HEPA filter is helpful. Avoid doing things that create other sources of pollution. So try to take mass transportation. Don't mow your lawn. Other things that release pollutants. Don't vacuum. That increases air pollution in your immediate environment. Do masks help? If the air quality is very poor, we get into the time period where we may try to consider wearing some type of air purifier or some type of mask to reduce the particulate exposure. And N95 masks are really and N100 masks are the only ones that have really been shown to be effective. So just buying a dust mask is not going to help. To wear those appropriately, they really need to be fit tested by a physician or by an industrial hygienist. And the person, if you're a man, you need to have a clean shaven face. So really wearing them appropriately can be difficult.
This season has gotten to be pretty bad. We've seen smoke from the east side of the state, California, and from BC. Last year we actually got ash in the air in early September.
Yes.
Have you, you may not know this, but I'll throw the question out there, do we know if this problem on this side of the state is getting worse as these fires have been getting larger?
Yeah, I mean, I think we can say that most scientists have predicted that wildfire seasons are going to be more severe and longer given climate change. So I think that is a real issue.
You had talked about the air index being above 100 currently. What is it normally?
Normally our Seattle air is fantastic, so it's usually around 50. We have very good air quality. So it's usually our air pollution is well below the national air quality standards.
What level would you recommend people actually start wearing masks at then? Because you said it would get to a certain point and then you might want to consider it.
Well, you can look at the AQI, the air quality index, online very easily, and there are different color categories, and where we're getting into the red categories or purple categories, that's where it becomes hazardous to most people. Once again, if you limit your exposure, it's probably not going to have an effect by just trying to limit the amount of time you're outside. But when we're in air quality indexes over 250, over 300, we're be maybe when I consider doing that. Once again, it's not something that's easy to use. You need to wear a mask appropriately. You need to have probably seen a doctor, get it fit tested. And so it's an individualized decision, I think.
What about for kids on right now, or kids wanting to play outside at this moment? Is it safe to be doing that?
Kids are considered in the more sensitive population. Once again, if they're not having any symptoms, then they're probably okay. I would maybe try to have activities for them to do inside instead, and this shouldn't last, I think predictions are that it will last through the week, but this is an acute thing, so maybe if you're a parent who's worried, I would try to engineer some activities inside for them.
And is that triggered at like the moderate or unhealthy range? Where do you tell parents, hey, now's when you look to keep your kids inside?
It would be, if I had a child who had asthma or some lung condition, I would say now would be when I would say try to keep your child indoors. If it's a healthy kid, I would not push that unless the parent is worried.
So like mommy joggers out there right now with their kids in their strollers, like they're okay to be out in this?
For brief periods of time, yes, probably. Mm-hmm.
And you talk about these acute effects. I mean, I'm a healthy person, and I've been hacking my life away for the past couple of weeks. I mean, so is this something that eventually just goes away, or is there potential for more long-term effects? You mentioned the word mortality, and it kind of got, then we asked another question, but when does this become serious? When do these effects kind of sit in our lungs a little bit longer?
So it's very common for people to have cough from just upper airway irritation. So a lot of those particles are settling in the mouth and in the nose, and that's causing people to cough. When it becomes more of a problem is if people develop a respiratory infection. And once again, we don't have great data to tell whether wildfire smoke is really even associated with increased mortality. So the studies and the science is not there yet.
Cora, we have kind of a broad audience. Some are listening more closely than others. Can you just describe what it means to be an acute situation as opposed to a chronic situation?
Yeah, an acute situation probably means something for a few hours, on the order of 8 hours to 12 hours, 24 hours. Chronic, we're talking daily exposures over weeks. So days versus weeks to months.
This may be, might not be hard data for this, but do we think that we're seeing more people entering the emergency room or urgent care right now dealing with these effects of, exposure on a daily basis?
Well, that's what studies have shown in the past, is there are more hospital visits and more emergency department visits from people in particular who have underlying health conditions. So we do have good evidence of that from previous events like that. This data is just coming in, our level of visits in Seattle, so hard to tell.
Are you seeing patients yourself?
Yeah, I see pulmonary patients in my lung clinic, and I definitely have seen patients who have very severe underlying lung diseases who tell me that they have more respiratory symptoms and worsened breathing during these episodes.
Does it make you sneeze more?
Does it make me?
No, me. I notice I'm sneezing more. I'm coughing more.
Definitely that could be a symptom. Yes.
So
dogs.
Probably animals as well. I don't know if we know the symptoms of animals very well, though.
So you'd say right now you don't recommend limiting exposure?
I said for most normal, healthy people, they can go around their normal activities. If you are in one of those sensitive populations, you should consider limiting exposure. And if you feel symptoms, then you should limit exposure.
What about tomorrow? Have you looked at the estimates tomorrow? It looks like it's going to be a lot worse.
I have looked at the estimates. Once again, I think we have real-time monitors, so that is something you can track, and people can track at home if they're concerned.
And do you have a specific level where you'd say, okay, guys, start paying attention?
If the AQI, the air quality index, is above 100, it means it's above where the EPA says is safe levels for these sensitive populations. So that's when you should start paying more attention to your body and your symptoms, and start maybe modifying your activities if you're one of those sensitive populations.